Vitamin D is a fat-soluble vitamin essential for calcium and phosphate balance, bone health, and immune function. Hey everyone, welcome back to the channel. If you're new here, don't forget to like, subscribe, and hit that notification bell so you don't miss any of our educational medical content. Before we begin, this video is for education and inspiration only. It's not medical advice. Be sure to consult a healthcare professional and double-check information with trusted sources. Deficiency is common across the globe and is linked to both skeletal and non-skeletal health issues. Vitamin D comes from two main sources: skin synthesis through UVB sunlight exposure and dietary intake. The skin produces vitamin D3, also called cholecalciferol, while the diet can provide either D2 or D3 forms. Vitamin D2 or ergocalciferol is plant-based and found in some supplements. Vitamin D3 is animal-based and also made in the skin. Once in the body, vitamin D undergoes two metabolic steps to become active. First, in the liver, it's converted to 25-hydroxyvitamin D, the major circulating form. Then in the kidneys, 25-hydroxyvitamin D is converted to 1,25-dihydroxyvitamin D, the active hormone. This process is tightly regulated by parathyroid hormone, calcium, and phosphate levels. Vitamin D plays multiple roles in the body. It enhances calcium and phosphate absorption in the intestines. It supports bone growth and remodeling. It suppresses parathyroid hormone to help prevent secondary hyperparathyroidism. It also helps with muscle function and immune regulation and may reduce fall risk in older adults. Associations have been reported between vitamin D deficiency and autoimmune diseases, cardiovascular disease, certain cancers, depression, and infections. However, many of these associations are still under investigation, and causality has not been fully proven. Testing vitamin D levels is not recommended for everyone. Routine screening is not necessary in healthy individuals. Testing is appropriate in specific situations including osteoporosis or osteopenia, chronic kidney disease, malabsorption syndromes like celiac or Crohn's, or after bariatric surgery. It's also indicated in chronic liver disease, hyperparathyroidism, patients taking medications like anticonvulsants or steroids, and in individuals with limited sun exposure or darker skin tones. People with recurrent fractures, unexplained bone pain, or suspected osteomalacia or rickets should also be tested. The preferred test is the serum 25-hydroxyvitamin D level. This test reflects total vitamin D from all sources and is the most reliable indicator of vitamin D status. Here's how to interpret the results. Less than 12 nanograms per milliliter indicates severe deficiency. Between 12 and 20 indicates deficiency. Levels between 20 and 30 indicate insufficiency. 30 or higher is considered adequate for bone and general health. Levels above 100 may be toxic. Vitamin D deficiency has both skeletal and non-skeletal consequences. In children, it causes rickets, leading to bone deformities and growth delays. In adults, it can cause osteomalacia, resulting in bone pain and muscle weakness. Deficiency can also trigger secondary hyperparathyroidism, increase the risk of osteoporosis, and lead to fractures. Beyond the bones, low vitamin D has been linked to autoimmune disorders, cardiovascular disease, type 2 diabetes, infections, and even cancer. Though associations exist, clear evidence for supplementation benefits in these conditions is still evolving. The goal of treatment is to restore adequate vitamin D levels, improve bone health, and reduce fracture risk. Supplementation is the mainstay of treatment. Vitamin D3 is preferred due to its better potency and longer half-life, but vitamin D2 is an alternative, especially for those following plant-based diets. The treatment dose depends on the level of deficiency. For adults, a common regimen is 50,000 international units of vitamin D once weekly for 6 to 8 weeks, or 6,000 units daily. This is followed by a maintenance dose of 800 to 2,000 units per day. For children, 2,000 units daily or 50,000 units weekly for 6 weeks may be used depending on age and severity. Maintenance for most adults is 600 to 800 units daily, but higher doses up to 2,000 are safe. People with malabsorption or obesity may need even higher doses. In chronic kidney disease, where conversion to the active form is impaired, active forms of vitamin D, such as calcitriol or analogs like paracalcitol, are often used. After starting treatment, 25-hydroxyvitamin D levels should be rechecked after 3 months to assess the response. Caution is needed to avoid vitamin D toxicity. Toxicity typically occurs with prolonged intake of more than 10,000 units daily. Symptoms of toxicity include nausea, vomiting, weakness, confusion, and high calcium levels. In severe cases, it can lead to kidney stones, vascular calcification, and renal failure. Treatment involves stopping vitamin D, hydrating the patient, and sometimes using diuretics or steroids. There are still ongoing debates and research about how much vitamin D is optimal and what outcomes it truly affects. High-dose bolus therapy in the elderly has been associated with an increased risk of falls. Trials are ongoing to explore vitamin D's role in preventing cancer, autoimmune conditions, and viral infections, including COVID-19. In summary, vitamin D is essential for bone health and likely plays broader roles in the body. Serum 25-hydroxyvitamin D is the best test for assessment. Routine testing is not needed for everyone, but is crucial in high-risk individuals. Deficiency should be treated with appropriate dosing based on clinical context. Safe supplementation and monitoring help restore health while avoiding toxicity.